Hello, thank you for joining. My name is Hope Newport. I'm the Family Services Manager here at the International FOP Association. And welcome to part 2 of our 3-part series on childhood trauma. Last week, we, in part 1, talked about trauma. Our wonderful presenter shared, some of the different types of trauma and what the factors are that go into really impacting which area or type of trauma a person experiences. And so now that we have that sort of foundation, that understanding, we're going to continue building off of it in today's presentation on the stages of trauma healing. So I'm so pleased to welcome back our speaker from last time. So Susan Dannon from Mindspring Health is a licensed social worker and therapist with over 25 years of experience. And Susan's hasn't seen anyone with FOP directly, but she's been wonderful to work with me to learn more about our community and the unique needs of our families. So Susan, I will hand it over to you to take us through today's presentation.
All right, thank you very much. So the presentation is being brought by Mindspring and IFOPA. So we really appreciate both organizations sponsoring this for everyone. So we're going to go through and just do a little bit of an overview. The things that we're going to be covering today are taking a brief look at childhood trauma and medical trauma. We covered that in the first one, but just to kind of give a brief overview of that again, just in case there's anyone who did not see the first one yet. And then we'll also be adding on to that a little bit. And then our focus will be on Herman's 3 stages of trauma as far as trauma healing. So phase 1 is about safety and trust. Phase 2 is direct trauma-focused work. And then phase 3 is affiliation and restoration to pre-trauma functioning. So talking about childhood trauma, kind of establishing, first of all, what is trauma? So trauma is an experience that triggers an intense physical and emotional stress reaction, exceeding the person's ability to cope and challenging their reality, causing a perceived loss of control. So we had kind of talked about last time that trauma really is a rupture to our meaning making. So we have kind of an idea of how we see the world, what we believe the world is supposed to be like. And then when something happens to us that challenges that reality, that is larger than what we feel we have the ability to cope with, that's when we see that as a trauma. And so we kind of talked about too is that really our perception of what has happened is what makes the situation traumatic. So for some individuals, one type of experience may not, cause any trauma whatsoever. And in that same experience, another person may feel very traumatized. So as we go through this, some of the things we're going to be looking at too today is a little bit about how to, help support kids during some of the medical procedures and those type of things to prevent some of the trauma from happening in the first place. And then the other thing is a lot of what we're going to be looking at with those stages of trauma healing, those are things not only can you use, if the child is showing a traumatic reaction, but you can also use them in preventing the trauma from happening in the first place. And also as a support system, after, medical procedures or things that, the child might consider traumatic to reduce the effect of the trauma that is happening. So obviously, a lot of what we're talking about is medical trauma. So medical trauma is the psychological and physical reactions of the child and or the family So we're also talking about caregivers and siblings who are witnessing, what the child is going through. And with that, that's going to be kind of the focus on the third webinar, which is tomorrow, which is how does this impact the the family as far as the caregivers and the siblings who are in the home. So we'll be talking about that tomorrow, a little bit more about that secondary traumatic stress. So medical trauma includes pain, injury, medical procedures, and treatments that may be invasive and or frightening. So when we talked about just kind of in general, we talked about last time how trauma really does impact the brain and how it significantly changes the brain. So it changes how the brain functions, how it communicates. And while the brain is significantly impacted by trauma, it can also grow with the right type of stimulation. So that includes relationship and especially nurturing and supportive touch, novelty, which is being able to do new things because doing something new helps to start heal the brain because it gives it something new to think about and to process. Physical exercise, especially any type of aerobic exercise that gets the heart rate up. Exercise is not just good for us physically, it's also good for us emotionally and mentally. And, our brain is a muscle. So by exercising our body, we're also exercising our brain. Mindfulness, focus, attention, we're going to be talking about that a little bit more in the trauma stages and how that can be helpful. But mindfulness is really about being able to focus attention on one specific aspect. And by focusing on that, then we're able to kind of retrain our brain, get our thinking brain back online. Nutrition and sleep is really important. So healthy nutrition, getting enough sleep. So we talked about last time that the calm nervous system is our rest and digest nervous system. It's where we get a lot of our healing. So sleep becomes very important. And then repetition and sensory and motor stimulation. So doing something over and over again to be able to learn it, understand it. And we're going to be talking about that a little bit more in the phases of treatment as well, is, how you do things over and over again in order to have that healing aspect. So with all that being said, this is part of what we're going to talk about with the preparing for medical trauma. So some things that we can do for children ahead of time to minimize the risk of them feeling traumatized is to be honest and upfront with them. I think that a lot of times we want to shield children from, painful thoughts and ideas, or thinking that it might upset them more if they know about the diagnosis. However, what we have found is that children, if they don't have all of the information, a lot of times they'll end up kind of filling in the blanks. And so if they don't have a full understanding, then they will start making up a story for themselves. And a lot of times, whatever they are, telling themselves can end up actually being more severe and more frightening than what the truth is. So we want to be honest and we want to be upfront with them. The other thing is if you're not honest and upfront with the kids, they lose trust in you. So if they end up finding out later that you weren't honest, that you hid certain things from them, that's going to make it much more difficult for them to trust you and believe that you are going to give them the information that they're going to need. And again, then they feel like they're not getting all of the information. And so they start filling in the blanks about what could be happening that they don't know about. I used to work in a hospital setting, so I have worked with a lot of children with chronic medical conditions. And one of the things that is really helpful in a hospital type setting is to be able to see if they have a certified child life specialist within the medical setting. Um, the certified child life specialist is an individual who gives parents and caregivers specific support and guidance around a child's medical diagnosis. They help you kind of find the best language to talk about what the things mean. They have resources for the child and the parents that they can share. And so they really are trained professionals who have a lot of tools and books to prepare children for things that they might go through. They sometimes will have teaching dolls, just really non invasive, concrete ways for the kids to be able to experience these things, which kind of comes to the point of letting them play with certain medical equipment and get comfortable with it before they actually have to use it. So that could include things like trying out a wheelchair before they're at a point of needing one. Because the more information that we have, the more that we become comfortable with things, the more kind of natural and neutral those things become to us. And so it is then less traumatic. Um, so all of this is really about meeting the child on their level, explaining FOP and any of the, types of services and medical treatments they're going to need with that so that they can understand that on their developmental level. So that's again where the child certified child life specialist can be helpful, is what information to give the child at what different developmental levels as far as what they're going to be understanding given their age. So preparing for medical trauma, talking about the siblings. Um, so when you have, a brother or sister who is going through chronic medical conditions, you have your own things that you're struggling with as well. So the siblings may feel confused and also need to understand, so they're also not filling in the blanks. And a lot of times the siblings can get left out of those discussions, sometimes unintentionally. And a lot of times I think we forget that, those siblings might feel just as lost and just as confused as the child with the chronic medical condition who is struggling with that. And with siblings, they may have a harder time feeling like they have a right to ask those questions. So being able to come with them and ask them, are there things that you're concerned about? What do you understand about what is happening? And like opening up that line of communication, just providing them time to ask their own question, to express their own fears becomes really important. Because one of the things that siblings will also often struggle with is survivor's guilt. So the survivor's guilt is where a person feels like they don't have a right to be disappointed or depressed because they, have a better life than someone else does. And so that can be kind of an aspect of where the sibling may feel guilty that they are asking questions or that they're expressing their fears and their needs because they're not the one who has the diagnosis. Um, so there is a really good resource that I found called Indigo Stork. It's a free downloadable book about having a sibling with a rare disease. So we have the link there, and I'm sure we'll be sending out that link as well. So that is a resource that you can utilize with the siblings of the child, that I felt was very useful and very helpful. And then also to just kind of be aware of the fact that, siblings might need their own therapy and support as they are going through, the trauma with their sibling. And, whether, the child with FOP is, having like significant trauma symptoms from all this, or if they're just, having, milder symptoms, there are still those things that are happening that are changes for everyone in the family. Um, and so that's again where we're going to talk about in that third session tomorrow. What are those major concerns for siblings and their families? Because one of the things that is traumatic for families is that this is something that you can't fix. And when we have something that we can't fix, that we can't control, that becomes a trauma, because trauma is anything that we don't feel that we have control over. And so, that is an aspect of all of this as well. So we're going to get into now looking at Herman's 3 stages of trauma. And this is about the stages of trauma and recovery. So this comes from Judith Herman, who developed these phases of trauma and recovery. So as I mentioned kind of in the overview, we've got those 3 stages. So it's safety and establishing trust, trauma-focused work, and then affiliation and restoration to pre-trauma functioning. And one of the things to know with like a chronic condition, especially any type of chronic medical condition, is that you're probably going to repeat these phases more than once. And the idea with going through the phases is the more that you go through the phases, the more that you give that support with a child with a chronic medical condition, the less traumatic it is going to be for them, and the less traumatic it's going to be over time. So as they learn these skills and learn ways to cope with what they're going through, the less traumatic that this is going to seem to them, and the more supported they're going to feel. So it is both to help kids who have, interpreted what they're going through as a trauma, and it's also for those kids as a prevention to help them have those skills so that as they go through life and as they go through the changes of this chronic illness, that they have tools that they will be able to use. So phase 1 is all about establishing that safety and that trust. So safety and trust is really important because there needs to be some level of safety. Otherwise, the child is in survival mode and they can't move forward. So this kind of speaks to some of those preventative factors that we talked about last time, of being able to have things in place for the child that is going to help them feel safe, is going to help them feel secure, so that as they are going through these things, they're not in that constant fight or flight. So the more that you can reduce that, fight or flight response, and the more that the child can stay in their calm nervous system, the more stable and the more resilient they're going to be. So healing for children, we're going to look at safety first. So when you bring that into the acronym, you have S for safety first, A, allow feelings, F, follow the child's lead, E, enable the child to tell their story, T, ties to reconnect, and Y, your children need you. So with safety, children need to feel safe. The safer the child feels, the less traumatic a situation is going to be. So let the children stay close to you when they need to. And, that's one thing with being in any type of medical setting, is to really advocate for staying close to the child during any type of medical procedures, if at all possible, so that they have that comforting, that soothing presence. If for some reason they're not able to be physically with you during any type of procedure, that they are given something that is going to be soothing and calming. So that might be having like a t-shirt that you've worn, or having a blanket that they had as a younger child, just any of those type of things that they feel kind of that closeness and that connection in some way. Assuring them that you are going to take care of them, that you are going to make sure that they are safe, is also another thing that is really important. So having that support from you, letting them know that the people who are working with all of you are there to help them, to provide them care. So that kind of goes back to that idea of looking for the helpers. Who are all the people that are helping you, that is going to help you feel safe and feel secure? And then looking at who is on the child's team. Who are your allies? Who are the people who are going to support you and who are going to support the child? And having discussions with them about what is it that your child needs, what is going to help them feel safe. Monitor what they watch and what adults say near them. So the other piece of advocating for your child is there can be a lot of misinformation out there, about FOP and any other rare diseases, because people are not aware of what it is really like to live with this day by day. They also may have seen, shows or those type of things that go to the most extreme cases. And so being able to monitor that and be able to have discussions. I think it's also important, if you believe that your child has heard something that might be scary or upsetting, asking them what they heard and what they understood and what their perception is important. So I always encourage parents to start with curiosity, rather than making an assumption about what the child may have heard or understood, because they may have interpreted what they heard differently than what you think they heard, as far as how they interpret it and how they internalize it. So I always start with questions and curiosity first. And then keep a predictable routine. The more that you have a routine, the more they know what to expect on a daily basis. That is comforting. Routines and rituals are comforting. And that can include coming up with a ritual or routine about visiting the doctor or other medical procedures. When we're going in, what things do we do before we go in? Is there something that we do afterwards as a comfort, or even in a sense, a celebration of, getting through this circumstance? Um, Rituals and routines are what give us a sense of grounding and stability. And then making sure to let them know what happens next. So transitions for kids are usually difficult, because if they don't know what to expect next, that can be unsettling. That is a loss of control. So the more that you're able to let them know about what's going to happen next, helping them through those transitions into those next steps, the more safe and the more supported they're going to feel with that. So then we get to the A part, which is allowing feelings. So young children oftentimes have a hard time verbalizing their feelings, and so they will act out those feelings. So for very young children, we want to help them learn how to verbalize those feelings. We want to work with them on, being able to label their feelings: scared, happy, angry, sad. So by naming the feelings, you're going to see less behavioral issues. Children act out when they are worried and when they're scared, because they don't know what is happening. They don't know how to ask for help. And so it's kind of remembering that difficult feelings can equal difficult behavior. So the more that they are able to express those feelings in a safe way and verbalize those feelings, the less they're going to have that need to act the feelings out. So I think it's really important to remember that when a child is acting out, it's not about them misbehaving or being difficult. It's about them asking for help. And so, how can I help this child in a positive way instead of a negative way? How can I let them know that it's okay for them to express whatever it is they're feeling? Which is another important piece is letting them know that it's all right to feel whatever they are feeling. Sometimes we can shut kids' feelings down by, saying that it's not okay to be angry or, this wasn't that difficult. I don't understand why you're so sad and upset about it. And some of that is about our own discomfort and wanting to minimize those feelings because we're uncomfortable with our child's difficult feelings. Or it may be that we were raised in a home where feelings were not okay. So we want to be able to give room and give space for the child to feel whatever they're feeling. So, what I often will talk to children about is whatever you're feeling is okay. And we just don't want to stay stuck in that feeling. So, we want to feel that feeling. We want to sit with that feeling. We want to honor the feeling. And then we want to figure out what do we need to do in order to move out of that feeling. Now, at the same time, if there are behavioral issues, you want to correct the child's behavior, not the feeling. So it's okay to be angry, it's not okay to hit. So even though we're going to, honor whatever feeling they're having, there are still going to be limits and structure around those feelings. So it's really more about that piece of helping the child express the feeling in a safe way. The other thing that we want to do is really try to focus on positive thoughts. So, talking about things that are going well. What are things that help you feel good? So, it's okay to have difficult feelings. It's okay to feel overwhelmed sometimes. And what is it that is going well today? Now that we've talked about what was difficult and what was hard, what things went well? What things do you think helped? Because again, focusing on those positive thoughts is going to help reduce the trauma and reduce how the child feels. Because if they're able to see some of the positive things, again, that helps them feel like they have more control. So the more control a child feels that they have over the situation, the less they're going to interpret their situation as traumatic. I think the other thing that's really important is about following the child's lead. Um, so different children need different things and they have different feelings about what is happening. So, as I said earlier, not every child with FOP is going to have, a trauma reaction to what they're going through medically. And some kids may have a very strong traumatic reaction. So we want to be able to step back and look at what is it that this particular child is needing? How are they responding? What kind of support is going to help them? And then, looking at then from a personal standpoint, what is it that helps them the most as far as releasing that trauma. Some children need to be very energetic. Some children need a calm space just to be held. So that's all about what we talk about in psychology. We talk about attunement. And attunement is how in tune am I with the other person and what their needs are. So being able to read the child's social cues, being able to notice what the child needs in the moment and then meeting that need. So listen to the child, watch their behavior, try to figure out what they need, and then trying to meet that need again in a positive way. The other thing that we often see in kids when they are going through difficult circumstances is what we refer to as trauma play. So children are not wired to respond and articulate trauma verbally the way that adults are. So thoughts and feelings are often projected onto toys, which provide children with a safe forum to explore fears and reactions to a traumatic event. So one of the areas that I'm especially trained in is what is referred to as play therapy. So I'm a registered play therapist supervisor. So as a registered play therapist, what I am doing with children is allowing them space to play, to watch their play and interpret that play, because a lot of times kids don't always have the words to express what is happening internally. And they are really good usually about showing us how we feel if we listen to their language of play. So, watching what the child is doing in their play and being able to reflect on that play, to notice what is happening in the play, is another way of attuning with the child. And regardless, again, if the situation with the medical trauma is, in the child's eyes manageable, or if it is something that is overwhelming, they're going to play that out. So any type of play that you have is going to show where they're at emotionally and how they're coping. You might also notice in their play positive things. So you want to also notice that as well. What are some strengths that they are starting to show in their play? That might be advocacy skills. It might be being able to notice the helpers who are there for them. Because I have specialized in medical trauma, I get a lot of kids who have medical trauma or anxiety around medical procedures, and they will play out those procedures, and they will have the doctors who are helping them and comforting them. So look also for those things that are strengths as well. So this is what is referred to as the PACE approach. So playfulness, taking a playful stance, adds elements of fun and enjoyment in day-to-day life, and can also diffuse a difficult or a tense situation. So that kind of goes back to allowing the child to play out these things. If there are any type of procedures that are coming up, that they are allowed to play that through to see how that's going to feel, because the more that they're able to play those things out, the more they incorporate them, the less traumatic it feels. And then afterwards, allowing them to play, because again, play is the natural language of children. So if after a difficult day or after a difficult medical procedure, it can even be a difficult day of school with FOP, allowing them that space to play is a way to allow them to release that tension from the situation. And the more quickly they are able to do that, again, the less of an impact that trauma is going to have on them. So allowing that space so that they can play those things out. And then we want to accept whatever is being played out. So unconditional acceptance is at the core of the child's sense of safety. So as they are playing these things out, resisting that urge to step in and try to redirect the play. So if a child is playing out something that happened to them that they feel is difficult, we don't want to step in and say, oh, well, they could have done this, or what about if this happens? Allow them the space to figure it out on their own. The more that they are able to process it on their own, to come up with their own solutions, the better that's going to be, because they are using the play as problem solving as well. Unless the child gets stuck, then we may want to step in as far as, if it's escalating, then we may want to redirect the play. But most of the time, we want to let it unfold and see what happens first. What we can do is we can come at it with curiosity. So the adult's intentions are to truly understand and help the child, not lecture or convey that the child's inner life, their inner dialogue about what is happening is wrong. And so it's really kind of a shift of, why are you doing that, to asking what happened to you. So if you have a child who is, having some of those difficult behaviors because of the things they're struggling with, instead of that blaming, why did you do that? Asking what happened to you? What's going on internally? What are you struggling about? I'm curious about um, what the stuffed animal said, and allowing that to be a conversation, because part of the purpose of play is to have kind of one step away from the actual circumstance, because then the child is talking about what is happening to the doll or the stuffed animal. They're not talking about what actually happened to them, and yet they are. So think of it as kind of a metaphor for what they are going through. And so talking through that metaphor is going to be safer than directly talking about the event sometimes. And then through all of that, having empathy. So the adult being able to stay with the child emotionally, providing that comfort and support, not abandoning them when they need you the most. So being able to sit with those difficult or those uncomfortable feelings and being that support system for them. So the other things to kind of remember with the PACE system is with the playfulness, if a child is exploring a subject through play, then it's usually because they are ready to do that, and they may also need to do that. So it can be something like a child anticipating the fact that they are eventually going to possibly need to be in a wheelchair. So they may be playing that out, and that may be difficult for us to see. And we may think, oh no, you're not at that point where you need that yet. Um, and we want to allow them to explore that, because if it's on their mind, it's better for them to explore it and have an outlet for it than them to keep internalizing it and letting it stew within them. With that, we don't want to shame them. So the children's play can trigger uncomfortable feelings, which is fine. And as I mentioned before, we don't want to indicate that it's shameful or it's wrong to have these difficult feelings. We want to create that space for them. And then part of the other piece of creating space is having multi-use toys. So we usually in play therapy will kind of categorize toys into 4 different categories: scary toys, nurturing toys, fantasy toys, and creative toys. So scary toys are there to play out things that they're afraid of or things that are scary to them. Nurturing toys are things like, kitchen sets where they're preparing food. It can also be doll houses, dolls, that the child is playing with and playing out those things that are nurturing. And also having like parents who are nurturing the child. Fantasy play is just any type of play that is, from the child's fantasy. It can also be about them pretending to be certain people. So, like I said before, I have a lot of kids, if they're working through medical trauma, that they will play being a doctor or play being a nurse. Um, so, making sure that they have those things available to them to be able to play those things out. And then creative toys are toys that can be used for, creating any type of art. Um, so artistic ways of being able to express themselves. So we want to be able to have those toys available to them, um, that they can use in a variety of different ways. And then this was kind of the piece I was mentioning earlier, is the watching for unproductive play. So if the child's play makes the child anxious, if it becomes too literal, if they become obsessive or repetitive, where it seems like they are getting more anxious, more stuck with the play, then it isn't serving its purpose. So instead of releasing tension, it's increasing their tension. That's where we may need to step in. So, it may be something like saying to a child, oftentimes monsters are the way that kids will will express fears. And so it may be something like, wow, that monster really keeps coming back. I see how shaky you are. I'm going to put the monster in a corner so he can't get at us and so we can take a break. Or I notice that you're getting really shaky and upset. What's something that we could do to take a break? And then we want to do something soothing, nurturing. So doing some deep breathing, coloring, or any other thing that the child enjoys doing just to allow them to release that tension. So that is phase one. So we're going to be looking now at phase two, which is kind of the direct trauma focused work. So the goals of phase two are to help children clarify and understand their thoughts, feelings, sensations, and responses, and to identify cognitive confusions and be able to discuss them. So cognitive confusions, cognitive just means thinking. So how is the child thinking, and are there things they're confused about that we need to clarify? Some other goals of phase two are to assist to identify, express, and regulate emotions. So helping the child self-soothe, to provide healthy alternatives and helpful coping strategies. We're also, with the play, part of what we're doing is helping them experience mastery through controlled recall. For older kids, it might be organizing a narrative, creating a story about what has happened to them. It's also about, utilizing a support system and then coming to a point of future orientation of how can we manage this in the future so that it doesn't feel so overwhelming. So one of the activities I often do with children in this stage is to create a safe place. So a safe place is important when it comes to children who may feel like they have no control. So that safe place can be anywhere. It can be them imagining their room. It can be imagining being outdoors. It can be a place that they may want to visit. It can be someplace in their imagination. But the entire idea is for them to come up with something that they can focus on. So normally what I'll do with the child is we'll sit down and we'll brainstorm what they believe their safe place is. And then either they can do it through their imagination, or if they want to color or draw. I've also had some kids who have done this as kind of like cutting out pictures from magazines and putting them together on a board. I've also done it in sand tray. So I have a tray that's full of sand with a lot of different figures, and I'll have kids come up with their safe place. And all of that is just to help them have an image of what their safe place looks like, what it feels like. I'll talk to the child about what are the sounds they hear in their safe place. What would they have in their safe place to help them feel comfortable? Who's going to be in their safe place to meet them there? And then I usually will encourage them to hang up, a drawing or a reminder of their safe place so that they can remember that they can close their eyes and go to that safe place wherever they need it. Because we found that if you can close your eyes and imagine something that feels safe, that feels calming, a place that you are at, it actually reduces the stress in your body in a very real and very physical way. So they know that if they're feeling stressed, if they're feeling overwhelmed, if something is happening, that they are able to imagine that safe place and therefore finding out how they can kind of get through that. So there was someone who came into the question and answer. Um, so much of FOP losses are slow creeping loss of movement or really long but devastating flares, year of flares stealing significant hip movement. There isn't in these cases an event that they would dwell on. What would the trauma look like in these cases? And how do we know if help is needed as parents? Especially for us parents of children who don't like to talk about their feelings despite years of seeing a psychologist. I think that that's all some of what I was talking about as far as just creating that space for them to be able to talk about those things. And I think the other thing is you if as a caregiver you're uncomfortable talking about those things, it's finding who is your support system that can talk to your child about those things. Finding them a safe space to be able to talk about it. I think with chronic illnesses, there is that piece of it like slowly coming over time. There's also, times where it will suddenly happen and be very intense. So, I think that's where things like the safe place activity is really good because you can use that when it is something that is small. You can use it when it's something that's big. So I think the other important thing with this is the more that you practice these skills with the child, when it's those little losses, the more that they're going to be able to use those as the bigger losses come along. And so in those cases, then they've got, those skills as they're continuing to move through the chronic illness and being able to utilize it regardless of the stage that they're in. So hopefully that answers the question. If you need any further clarification, please feel free to hop on, um, and I can answer anything else with that.
Susan, can I chime in with one thing?
Sure.
I was going to add to that you had mentioned earlier, taking in feelings and recognizing the hard, but also focusing on the positive. And so, trying to find something, and especially this question was related to the teen tween age, which can be difficult because their positives a lot of times are based more on their peers and the socialization and the independence that they're trying to seek towards at that age. And when I was working in the hospital as a child life specialist, one of the things we used to do with the teens who were missing out on a lot of those opportunities was to create sort of a schedule or a calendar where you could kind of work on focusing some of the positive around any of those social events. Or, you have the loss that's coming with that. Maybe it's a wheelchair, the difficulty moving around, but what are some of the positives, specifically looking at their social network and their peers, that you can kind of put into writing into a calendar of events or something like that for them to focus on?
Yeah, I think that's a really good idea. And that's, kind of that piece with, helping kids throughout their ages of finding out who their helpers are, who can they go to, who is their team, who is going to support them. And I think you're right, especially in those preteen and teenage years, a lot of times that's their social group. So who do they have within their social group? And that can include also like teachers, other people that they trust. Because yeah, usually at those ages, the parent caregiver is going to be one of the last people that they're going to go to. So, finding those other people on your team and, kind of assessing that and helping the child, I think, assess it too. Who is on your team? Who is it that you can go to that's going to help you work through these difficult feelings? So breathing. Breathing is really important in any type of calming activity. Breathing calms our nervous system. It reduces our stress. It helps us develop self-control and attention. And it helps, children and adults, quite honestly, cope with and address their feelings. So, I think with all of that, the thing is whenever we go into fight or flight, we are typically breathing from our chest. So we talked about, the sympathetic and the parasympathetic nervous system, the calm and the active. So when we get activated, our breathing moves to our chest because breathing from the chest is quicker breaths. It is more shallow, but it is also getting oxygen to the body more quickly. So teaching children to move that breath into the belly and taking those deep belly breaths is one of the quickest ways to calm the nervous system. Because when we start breathing from the belly, that tells the mind, it tells the body that we are safe. So, it's taking those deep inhales through the nose, relaxing the body, and exhaling it out. And then just kind of noticing how that feels. So that's one of the quickest and easiest ways to start and activating that relaxation system, um, to be able to calm ourselves. And then any type of mindful movement. So mindful movement is any movement that releases physical and emotional energy. So we're wanting to stretch the muscles to give an energetic calm. I am a registered yoga instructor. So one of the things, that I do is that I have some training in adaptive and chair yoga. So yoga doesn't have to always be standing up. You can get just as much of a stretch in seated yoga. And in fact, to be quite honest, some people are surprised that you can even get some deeper stretches in seated yoga than you can when you're standing. Um, so anything that's going to stretch the muscles, yoga is also really good because yoga focuses on moving the spine. So if you think about, the spine as um, where all of our nervous system is at, that is massaging the spine. So it is energizing and calming at the same time. And then swimming is another really good activity to release physical and emotional energy. It's, safe on the joints. So it's another one that can be really positive. Adaptive bike riding. So again, that's that aerobic activity, trying to get the heart rate up. And then taking mindful walks. So with mindful walking, what we're doing is we are creating something physical, but also mental. So as you're taking that walk, it's about noticing your senses. How do you feel the air? What are you hearing? How is the light reflecting on different objects? You can also use what we refer to as the 5, 4, 3, 2, 1 method. So find 5 things that you can see, 4 things that you can hear, 3 things that you can touch, 2 things that you can smell, 1 thing that you can taste. So, any of those type of mindful movements are going to help enhance mood. They're going to help release physical and emotional energy. And we found that, movement and those mindful movement can be just as effective as some antidepressants on depression and anxiety. So the more that we do those positive things for our nervous system, again, those are going to be protective factors as well. And then enabling children to tell their story. Having a story helps children make sense of things and cope with it. So for younger children, it may be using play to tell their story. So tell me the story of FOP. What does that look like? What does that sound like? What is that experience like? And then joining with the child in not just telling what happened, but also the feelings that go along with that story. And again, we really wanted to follow the child's lead. That the story may be difficult. The child may need to take breaks from the story, and that's perfectly fine. We take it a piece at a time. And then again, for yourself, get support if it's too hard for you to listen without becoming upset. And that's where, as a parent, as a caregiver, you may need other professionals to step in to provide that support for the child to go through their story. Respect expressive arts for older children. So for older children, sometimes rather than play, I've done kind of like a comic book style. So creating a narrative of what's happened in a comic book. So art, drawing about trauma, how does it look on the outside and how does it feel on the inside? Sand tray is something that I use from very young children all the way up through adults. So show what happened, expressing feelings around what happened in the sand. So we have like several miniatures that people can pick from and can put in the sand to represent different things that they're experiencing or going through. And then this last phase is affiliation and restoration to pre-trauma functioning. So like I said, with a chronic illness, you may be going through these stages more than once because there's going to be multiple traumas over time. And so the more that they go through this, the more of that protective factor it has. So in this last stage, after a child has gone through a difficult circumstances, having a discussion of trust and safety. What have they learned from this experience? What do they want to take with them? What worked? What didn't work? What would they do different next time? Anchoring it in resources. So, okay, if this was what you struggled with this time, what is something that we can add on? What's something that we can find information on that is going to be helpful for next time? So it's all about promoting competence and well-being. What do I know? What can I figure out? How can I solve this problem? What can be done differently? So all of this is about prevention and skills training. So it's education, but it's also family dialogue. And then we come to that point of integrating the trauma. So we are who we are and we acknowledge what happened without becoming overwhelmed. So this is the one thing with a chronic illness is that over time, you start to acknowledge that this is what this is. And it no longer becomes such a focus, and it becomes more of the fact, okay, I understand this, I understand what I need to do, and so I'm not going to be as overwhelmed as time goes on. There's also another piece of honoring the grief and the loss, which includes ambiguous losses. So that can include fear, a loss of control, a feeling of helplessness or hopelessness. It can be grieving those little losses along the way of things that happen throughout FOP and the changes that it caused. And all of this is really about being able to embrace suffering. So suffering is any time that we have a difficult circumstance. And the purpose of suffering is to find compassion. So it's really about transforming the suffering into compassion, compassion for ourselves and also compassions for others. So we don't want to feed the suffering, we want to transform it into compassion. And then after any type of difficult circumstance, we want to have time to reconnect. So reconnecting to supportive people, to community, to cultures, to rituals, creating positive energy. So like I said, if it's around a medical procedure, a flare up, it can be about having some type of way to celebrate those things ending, to honor the suffering, but also to honor the end of suffering. And so finding simple ways like a familiar story, a song, or tradition that remind the child of stability and hope. And then it may be doing that tradition, tapping into those things as a preparation and a way of protecting when something else comes along, so that they can use it like during a flare up. And each time we do this ritual to help us get through this. So you can help the child best when you take care of yourself. So also get your own support, nurture yourself. That's all of what, actually the third session that we're going to be working on is we're going to be looking at how do you help yourself as a caregiver, as a parent, with secondary traumatic stress to take care of yourself as you go through this. So I've got the resources here, which will also be sent out. So I have some resources from IFOPA and some other resources as well. So the Safe Place activity, the Indio Stork is in there. Some recommended readings that will be sent out as well. Some of them were ones that we utilized in the presentation. And then there are also some other recommended readings. This is the contact information for Mindspring. So if you want to get a hold of us. And again, we just wanted to thank Mindspring and the International FOP Association for hosting all of this today. So I just want to thank all of you for being here.